Going to start now.
Okay, let's start. With the permission of the ma'am, we should start.
Director ma'am?
Ma'am?
Director?
Yes, I'm here.
Yes,
we are going to start, ma'am.
Yes, you may start.
Okay, with your permission. Okay, Dr. Karu, start. Please start.
Really? Okay. Namaskar. Good afternoon to everyone. Myself, Dr. Gaurav, lecturer in the Rachna Sharir department near Shillong. Welcome one and all of each of you who have joined this webinar come workshop, which will be a series long workshop as per our director madam permission and will. So we are going to have two lectures today from prominent, and specifically I want to say they are not too much in age wise, but they have been expert in their own system. Like we are going to talk about two systems today. One, especially Dr. Pratap Sankar will talk about the Marma, specifically on the Siddha Marma or Tamil Marma, which are mainly called Varma. And Dr. Gautam will be on the Kalari. So we welcome both of you, sir, and we welcome each and everyone who has joined. I think this particular type of workshop or webinar will be helpful to enhance your knowledge and will be helpful to use this traditional skill in our modern day practice also. While I am the lecturer of Rachna Sharir or student of Rachna Sharir, I have always learned as Marma as just a topic, but it's always fascinating to me specifically that how to use this particular topic in clinical practice beyond the theoretical part. As it is also said, Marma is equivalent to the half of the surgery or Sali Ardha, Visayardha. So how this Visayardha is going to be used in practice? Normally, Marma is said to be vital points. They are secret points. They have to be saved. But what we can do with these points is what the query, most of us are having this query. How to use it? What are the points we have to do it? So let's be enlightened with the views of our respected speakers. And I now forward my point to the director madam to give a small welcome to our guest speakers and give her thoughts on the importance of Marma therapy in present scenario. To you, madam.
Namaskar to everyone. Good afternoon, everyone. I welcome you all to this Jnana Arjana Yajnam. Now, today's modern world we all know, but we know what a rich history India had, Ayurveda had. The legacy has to be going forward only, and this can be carried out only when we revive whatever we have lost because of the invasions. Because we cannot say it is only due to the history that has happened, and we all know the Marma therapy. The Marma is getting popularized nowadays with advent in these digital platforms. What we have, everybody is aware now, and so it's very important that what significant things are present in Ayurveda should get an impetus and they should be glorified again. So we all know, I won't go into details, Marayanti, Iti Marma, but I was also very much fascinated because when I started as my career as lecturer, so this was the first topic I taught because I was teaching anatomy then instead of gynecology because the college was in the first year, and I thought I really was enjoying learning about this therapy, the vital energy source, the pran, the panchamahabhut, how it is lying deep into the tissues covered. So sometimes it is Marayanti Iti Marma when we go with Sadhya Prana Har Marma, and when it is Sandhi Sthanam. So how best we can utilize the knowledge of our speakers today to know Kalantar Marma and all these things in detail. So I welcome you all to know about the history of martial arts of today, the Kung Fu, the martial arts, what all we know have been glorified from southern India. The battlefield, we all know the ancient history that Parshurama was very valiant and very much professed into this martial arts of India, which has gone through Buddhism towards China, and now there it has been glorified, the acupressure, the acupuncture, everything is all जहां पर सीमित हो जाता है वह आता है मर्म थेरेपी और आयुर्वेद. तो over to you both, sir. I respected Dr. Pratap Shankar ji and Dr. Gowthaman sir. I welcome you to the session, and I know that we all will be enlightened through you. Thank you so much. I congratulate my team also, and I also congratulate those who have joined with us in this yajna. Thank you so much.
Thank you very much, ma'am. So moving forward towards our webinar right now. So I will request all who have joined, if they have any query, they can put on the live chat directly on the YouTube, and from there we are going to forward your questions to the experts so that they can answer them specifically. So today we are going to have two lectures, as I have told you previously, and first lecture is going to be given by Dr. M Pratap Shankar sir. He is research officer Ayurveda, right now posted in the National Ayurveda Research Institute of Panchakarma, Kerala, under the CCRS Ministry of Ayush. He is working in the he has worked as an assistant professor in the Department of Salitan, Santagiri Ayurveda College, Palakkad. He has published books and developed the content of the book specifically to tell you the Marma Chikitsa basic tenets in the Ayurveda and therapeutic approaches, which is published by CCRS on 2020. He has published 17 articles in the national and international peer-reviewed journals, attended many conferences, many seminars, and also he has been associated with the documentation of effective Marma practices, a documentary research project, also associated with the documentation of Visa Chikitsa practice, a documentary research project. Sir has won many awards, has presented many papers in the different seminars like Global Ayurveda Festival, World Ayurveda Congress. So on the behalf of NIA Shillong, I welcome you, sir. Sir's elaboration or deliberations will be on the topic of introduction to Marma therapy. Especially, he is going to talk about the points which are from the Tamil Marma, or you can say Varma. So now handing over to the sir.
So namaste, sir. Hope I'm audible, sir.
Yes, sir, you are audible.
So first, let me share my slides.
Yes, sir.
Sir, is it possible to share my slides? Is that any from your side? Anything you have to do? Because it's not able to share.
From my side, everything is clear, sir. You just try once again.
Sir, shall I rejoin again, sir? It is not, slide sharing is not open now. I will rejoin once again, sir. Sir, hope my slide is visible now. Sir, I'm audible?
Yes,
Sir,
yes.
you are audible and slide is also visible, sir.
Sir, shall I put my slide in full view?
Yes, sir. Yes, sir.
Is it okay, sir? Is it visible now?
Yes, sir, it's visible. You put in
The full slide?
The full slide is not visible. Just wait for.
The slide is not moving, sir? No.
Slides are not moving, sir.
Okay, one second. Okay, the full view is not working. Anyways, I will proceed with this itself. Hope it is the slide is visible clearly.
Sir, try to move it. Try to move it a little bit. Next slide, you put next slide. Yes, it's moving. Okay, fine. You can start your topic, sir.
Yeah. So namaste to all. So namaste, respected Needu madam, Director, Northeastern Institute of Ayurveda Homoeopathy. And first of all, I want to extend my gratitude to the Department of Shalya and Rachna Sharira, especially Dr. Alok sir and Gaurav sir for inviting me. and all the faculties of the institute. And first of all, that is before going into my presentation, I just want to clarify the thing is, I am not a person who has vast experience in Marma Chikitsa, or I am not a traditional practitioner in Marma Chikitsa, but I have been associated with this great science since 4 to 5 years because of a project which was underwent in our council, CCRS. It was the documentation of Marma Chikitsa among the eminent practitioners. So we try to document different Marma Chikitsa practices prevailing in India. So we were able to document 22 to 24 practitioners, and finally it came out as a publication. And as a step forward, we are doing a certificate course also on Marma Chikitsa in our institute, giving on a hands-on training, practical training to graduates, Ayurvedic graduates. So whatever I convey in this session, it is from the knowledge of this documentation and through the publication. So with this introduction, I'll go to the presentation. So what is Marma Chikitsa? So Marma Chikitsa, based upon the deep understanding of the anatomy and physiology of the human body, it utilizes various, that is vital points or areas of the body for preventive and therapeutic health benefits. So it involves various manipulative techniques, that is stimulative techniques, to complex procedures like Abhyangam, Bandhanam, Lebanam, Dara, etc. So we all know that what is Marma. So Marma are the seeds of various seeds or specific locations of prana, that is the life force in the body. So when we see the word Marma, according to the Shalpa, that is the Shabda Kalpadruma, it is formed with 3 syllables, that is Ma, Ra and Ma. So the Ra symbolizes Agni and Ma symbolizes Soma. So it is said that the Agni, that is the Ra part, it is ensheathed by the Soma part. So all the diseases which are affecting the Marma is considered to be in Madhyama Roga Margam. So usually the Sira and Snayu Gada Rogas are considered to be Marma Abhigadas. And as I told earlier, it is a seat of prana. Prana which circulates throughout the body. If it in a specific time, if it gets localized, if it locates in a particular Marma, and if that Marma gets injured, then the fatality becomes severe. Similarly, the cause of Marma Abhigata is not only the Aganduja, that is the external Marma Abhigata, but there are internal pathogenesis also. For example, if there is Kapha Avrita Vada in the Manibandha, then it results in a condition called CTS, that is the carpal tunnel syndrome. So there is also a Nija Marma Abhigada also can occur, and this also can cause Marma Abhigadas. So according to Vedanta Darshana, our body is divided into 5 koshas. That is the Annamaya Kosha, Pranamaya Kosha, Manomaya Kosha, Vijnanamaya Kosha, and the Anandamaya Kosha. Marmas are located in this Pranamaya Kosha. So this is the physiological aspect of Marma. When we see the structural aspect of Marma, so all we know that Marmani, Mamsa, Sira, Snayu, Asti, Sandhi, Sannipatah. Teshu, Swabhavata, Eva Visheshena, Pranas Tishtanti. So as a structural concept, Marma is the junction of Mamsa, Sira, Snayu, Asti and Sandhi. So if we see the classification of Marma, the structural classification is based upon we can classify as Mamsa, Asti, Snayu, Sira and Sandhi as per Sushruta, and Dhamani, that is Vagbhata has added Dhamani also. So all these is a known fact to all these our BMS graduates. So the Marma is also it is also classified based upon the local, that is localization in the body, that is based on Sharanga. That is the Marmas located in the upper limbs, Marmas located in the lower limbs, Marma located in the trunk and the head, and that is the Uddha Jatrugada. So when the Marma is located, when a large group of Marma is located in a single area like Shiras, it is called as Mahamarma. Similarly, we have Hridaya and Basti, which is mentioned as Trimarmiyam in the Charaka. So that is, if we see the Dosha Pradhanya, Shiras Mahamarma can be taken as Kapha Pradhana, Hridaya can be taken as Pitta Pradhana, and Basti can be taken as Vada Pradhana. So though this Marma is located in the Madhyama Roga Marga, it should have a structural measurement. So that's why the Marma points are specifically have that is the size as half angula, or it may be 1 angula, 2 angula, or 3 angulas. Now, if you see the effect of injury of Marma, it can be either Sadhya Pranahara or Kalantra Pranahara, or it can be Vishalyagna, or it can be Vaikalyakara or Rujakara. So if it is depending upon the vicinity of the injury, this the prognosis of injury can be ascertained. For example, if it is located at the center of Sadhya Pranahara Varma, it can immediately kill the person. But if it is located in the in the peripheral of Sadhya Pranahara Varma, then it can be a Kalantara Pranahara Varma. So the prognosis goes like this. So now, if you see the functional aspect of Marma, according to Sushruta, he has mentioned 12 pranas, that is the Agni, Soma, Vayu, Sattva, Rajas, Tamas, Panchendriyas, Bhudatma. So all these 12 pranas are located in the Marma. So Marmas are called as Pranasthanas. Now, if we see the general symptomatology of Marma injury, which is mentioned in the Sushruta Sutra Sthana 25th chapter, that is, he has mentioned Brahmaha, Pralapaha, Patanam, Pramoho Vicheshanam, Samlayana Ushnatesa, Srastangata, Murchana, Murdva, Vata Striviruju, Vata Kritashtasta, Mamso Udagabam, Rudiram Chagachet, Survey Indriyartha, Artho Uparamastataivacha, Dasharda, Artha Sankeshu api Vikshateshu Samanyato Marmasu Lingam Uktam. So this is the general symptomatology of Marma injury. So when we assess this general symptomatology, it correlates nothing but the symptoms of shock. That is, it can be a hemorrhagic shock or a vasovagal shock or any type of shock. Now, if we see the different types of Marma Abhigadas, that is the Sira Abhigada or the Snayu Abhigada, if we assess each one of them, then we can see in Sira Abhigada, there is, we can see that is Sravet Raktam. So there is a hemorrhagic shock can occur. So if in the case of Snayu with them, it can be either Kaubjam, Sharir Avaya, that is there is a deformity of the body, or it can be a Kriyashu Asakti, that is there is a loss of function in the body. That is we can take, that is it can be a damage to the entire spinal cord, or it can be a damage to the peripheral nerve. That comes under the Snayu with them. And if it is a Sandhi with them, then it can be that is the bones or joints are affected, then it can be a osteomyelitis also. For example, it is or it can be a septic arthritis, that is Shofa Ativruddha Mula Ruja, that is it causes severe pain in the joints. Now, if it is the Asti with them, then it is, as I told earlier, it can be either a bone fracture, or it can be osteomyelitis. So these are the various Marma Abhigadas which can be correlated scientifically. Now, if you see the importance of knowledge of Marma, as it has been told in the introductory session, this Marmani, Shalya, Vishaya, Ardham, Udaharanti, that is Marma Jnana is regarded as of the part of Shalya Jnana. And it is told that if a person who is affected with Marma injury, either he will have a Sadhya Pranahara, that is, the death will occur immediately, or if he lives because of Vaidya Gunena, Jivanti Tatra Yadi Vaidya Gunena, Kechik Ati Prapnavanti Vaikalatvam, that is Vikalatvam. Vikalatvam is nothing but he will surely have any type of deformities. Whereas, for example, rapt example is the spinal cord injury. Even though because of any fall, if there is a vertebral damage to the spinal cord, even after any surgeries, even after the vertebra is corrected or the fracture is corrected, but the damage to the spinal cord remains the same, and the patient will be suffering from the spinal cord injury. He will be having this quadriplegia or paraplegia. Now, there will be a question arising in our mind: is Marma Chikitsa mentioned in Ayurveda? Yes, that is, we can say that all the preventive aspects which are told in the Sushruta, that is the Sharira Sthana, the preventive aspect is even more emphasized than the curative aspect. But we can say that the curative aspect is sporadically, it is mentioned in various chapters like Vrana Chikitsa and Shashti Upakramas of Vrana Chikitsa, Bhagna Chikitsa. And if for the management of this residual damage of this Marma, the line of general dosha Chikitsa like Shodhana and Shamana Chikitsa can be adopted. And we can also incorporate Vadavyadi Chikitsa, Samnyasa Chikitsa, etc. So the general principles of management of Sroto Dushti can also be adopted in Marma Chikitsa. For example, if there is a Atipravarti, then in case of Atipravarti, then we are doing Marma Abhigada, then we can do bandages so that we can immobilize the doshas in one part. If it is Sanga, that is immobilization of the part, then we can do Abhyangam or Swedanam, etc. to remove the Sanga. If there is a Vimarga Gamanam, there is Vimarga Gamanam of Vada, then what we can do, then we can bring back this Vada dosha to that site by the manipulation techniques, and we can stabilize the Vada dosha through bandages, etc. Now, there are numerous indirect references of application of concepts of Marma in Ayurveda. That is, for example, there is specifically told as application of Talam during various procedures of Panchakarma, especially in Svedana, especially in Pidichal and all. They will do Talam, that is usually a paste of any powder, example Rachna Churnam or Bala Churnam, is kept as a paste over a Talam. This is nothing but protecting the Marmas of the Shiras, especially Adipati Marma. And for example, in the case of Nasya, that is, it is told as Dattamatre to Nasye, Karna, Lalata, Kesha, Bhumi, Ganda, Manya, Skanda, Pani, Pada, Tala, Mardhayet. That is, during the procedure of Nasyam, all these parts are massaged, especially the Marma parts, that is the Skanda, Pani, Pada, Tala, and the Manya and the Shiras. Everything is massaged because where the important marmas, the Shiro marmas, the Urdhva Jadrugada marmas, and the Talahriday marmas are located. So all these have specific indications in the Nasya karma also. So when we see the Pumsavana karma, that is Pumsavana karma, it is specifically mentioned that is the right and left side of the body. That is, we have to give, we have to inflict the Swarasa in the right nostrils, etc. So the body is divided into right and left. So this is based upon the Ida and the Pingala Nadi, which is mentioned in Marma Shastra. So the other treatment procedures, which are like the Bandhana, Lepana, Vasti, Daras, that it can be a Kashaya Dara or the Taila Dara, Shiro Daras, and Shiro Vastis, all having the base from the Marma. Now, various cultural and social practices also related to Marma. For example, the application of Dindi, that is, we apply in the forehead, that is, it stimulates the Sapani Marmam. The ornaments which we wear in the head and also in the which we wear in the chest region, it protects the Marma in the head region, and also the chest region Marma like Apalambam and Apastambam is protected. And you all know that that is, the Brahmins will wear the sacred thread like which is called as Punul in southern India. So this protects it protects the Marma which is located in the chest region, especially the Amsa Marma, Apalapa Marma, Brihati Marma, etc. And the Anganyasa and Karanyasa, which is mentioned in the Vedic rituals, that is, it stimulates the Apalapa Marma and also the Marma which is located in the Pani Pada Talam, that is the Talahriday Marma. So various yoga postures also are designed to stimulate this specific Marmas. That is, for example, the Shadang, that is the Shirshasana. That is commonly yogic postures are like Shirshasana. It stimulates the Adipati Marma. Now, the word Marma is numerously mentioned in Vedic and other Sanskrit literature. That is, it is mentioned in the Vedas, in Grihya Sutra, Upanishad, Smriti, Itihasas, Puranas, and other Sanskrit literatures such as Arthashastra, Kama Sutra, etc. So we have a very important reference in Rig Veda. You can see the sloka, Marmani te Varmana Sadayamani Somasya Radhamritanena Vastam. That is, here the importance is both the word Marma and Varma is mentioned here. So that is the importance in this sloka. And you can see in Garbha Upanishad, the Saptodara Marma Shatam is mentioned. That is, the numbers of Marma is mentioned. That is, 107 Marma is mentioned in Garbha Upanishad itself. Now, in the case of in Mahabharata, it is mentioned as a person who is having a good knowledge of Marma. He is mentioned as Marmatnya. That is, Sarva Marmani Sampreksho Marmatnya Lagustavat. Now, what is Marma and Varma? So, this is used extensively in Sanskrit literature. There is both these words are used. There is numerous references of both these words in Vedic literature also. The word Marma in Vedic literature means, it is specifically mentioned as Mru Marane. That is, the meaning that which causes death. That is, it is mentioned in a negative quotation. But the word Varma, that is Vril Achadane, that means that which protects or covers the body, that is called Varma, that is mentioned in a positive quotation, positive connotation in the Vedas. So, Marma and Varma are used at the same time in our Vedas and also in our Ayurvedic text. Now, if you see the various methods of Marma Chikitsa which are in practice, you can see that different types of Abhyanga can be done as per the Marma Chikitsa. That is, you can see the different names of Abhyanga is mentioned. That is, Anulebanam, Avapedanam, Pedanam, Udgarshanam, Udveshtanam, Paripedanam, Lathaveshtanam, Sandhicharanam, Akshara Thirumal, and Garshanam. So these are the various Marma Chikitsa Abhyangas. So what is Anilepanam? Anilepanam is nothing but that is the massaging technique of a group of muscles. Avapedanam is nothing but massaging technique to a single muscle. For example, deltoid muscle will be only concentrated. Pedanam is nothing but a hardcore massage. That is severe pressure is given. That is with the base of the hand massage is done. In the case of Udgarshanam, it is nothing but the opposite side massage. That is, massage is done from the lower part to the upper part. In case of Udveshanam, it is done in a roundward, there is a circular manner. What is Paripedanam? Paripedanam is nothing but the pressure which is given more than in the massage of Pedanam. That is, for example, the Cheruthuruthy, it is mentioned in Kalari. That is the massage with the foot. With the feet, what massage is done, that comes under Paripedanam. That is, more pressure is given. Then next massage technique is called Lathaveshtanam. Lathaveshtanam is a synchronized or a systemic massage. That is, starting from one part, that is the right side of the body, to the left side of the body. The massager will start from the left, right hand goes to the center part of the body and goes to the left lower limb. This is called as Lathaveshtanam. And similarly starts from the left side lower limb, goes to the middle part of the body and ends up in the right upper limb. So this is called as Lathaveshtanam. Sandhicharanam is the massage which is done in a particular joint. Akshara Thirumal is nothing but a specific massage done over, that is particular pain trigger points, for example in fibromyalgia, etc. And Garshanam is nothing but the massage which is done to improve the blood circulation. For example, in arterial diseases, it is done in the downward direction, whereas in venous diseases, it is done in the upward direction. Apart from this, there are various Nadi, Marma, Abhyanga technique also. For example, there is Tadaval. Tadaval is nothing but a massage with a very light pressure. Thirumal is nothing but with that is the massage with a somewhat increased pressure than Tadaval. Tape is just a simple massage, just a simple application. It is not a massage, it is the simple application of oil. That is called as paper. Mardhanam, Udmardhanam, Paripedanam are nothing but the different massages which are done with different quantum of pressure. Mardhanam is a medium contour, Udmardhanam is higher contour, and Paripedanam is more higher than the Udmardhanam. Next, Udichal is nothing but the massage technique which is done based upon the contour of the muscle and also based upon the direction of the hairs. Next, Tattal is nothing but a percussion. That is, like when we do kili and all, we give percussion type of massages. Now, what is Vimalapanam? Vimalapanam is nothing but a massage which is done by our angushtas. That is, that is Sandamshanam, which is mentioned in Shalya. So it is similar to Vimalapanam. So these are the different types of Abhyanga, which are Abhyanga procedures, which are innovative Abhyanga procedures done in Marma Chikitsa. So there are different types of bandhanas which are done in Marma Chikitsa, different types of lebanas. It can be a alepa, or it can be a pralepa, or it can be a lepana, or a thick lebanam which is done in ubanahas. And there are different types of daras like the Kashaya Dara, Kshira Dara, and Taila Daras, etc. So all these are the different methods of Marma Chikitsa which are practiced in Ayurveda. Now, when we see the different schools of Marma in India, it can be classified in three types. That is the classical Ayurveda tradition of Marma, the Tamil tradition of Varma Shastra, which is practiced in the southern part of India, that is in Tamil Nadu, and also in some part of Kerala, and the Kalari Marma related tradition, that is the Kulayana Marma or Kula Bhyasa Marma, which is practiced in the Kerala and some parts of Tamil Nadu. So as I cover the Ayurvedic aspect, I will be telling about the different Dharma, that is the Tamil tradition and the Kalari tradition. Now, Tamil tradition of Varma Shastra tells about 108 Varma points. That is, specifically, they have mentioned 12 Padu Varmas. That is, it is related to the brain and the nadis. That is, they have mentioned nadis which are similar to our Srotas. That is 12 in number. And these each 12 Padu Varmas, it is related to one Todu, that is 8 Todu Varmas. So 8 Todu Varmas are related to one Padu Varma. So 8 into 12, 96. So there are 96 Todu Varmas. Okay, and as I told, this Varma Shastra is related to our Ayurvedic Shastra also. They have classified this 108 Marma points into that is Doshaja aspects also. That is, there are 64 Vadaja Marmas, 36 Pittaja Varmas, and 8 Kapha Varma points. So if we see the fundamental aspects of Varma Shastra, it is based upon Sara. That is, Sara is nothing but similar to our prana. That is, as prana circulates through our body, similarly they consider Sara is the life force which circulates throughout the body. And the term Mudichu is nothing but the networks or the junction point where one or two nerves are uniting. You can see these are the different mudichus. That is for example, the first is the Pidari Mudichu, Pidari Marma, or the Mudichu, which is also called as Karnadi Mudichu, which is located in the C1 vertebra. Valaya Mudichu, which is mentioned, which is located over the C7 vertebra. Tunnel Mudichu is located over the T10 vertebra, and Pasa Mudichu, which is located over the L5S1 junction point, and Kumbaga Mudichu is located over the coccyx. So these are the mudichus are nothing but the junction points where one or more nerves meet. Now, Dasha Vayus, they have mentioned Dasha Vayus. Vayus are nothing but the force which is responsible for the circulating of Varman energy. As mentioned in Ayurveda, they have mentioned 5 types of the Vayus also. That is, they have mentioned the similar to our Shastra, that is, they have mentioned the Prana, Udhana, Samana, Apana, and Prana, Udhana, Samana, Apana, and Vyana. And similarly, they have added 5 other types like that is Naga, Devadatta, Dhananjayam, etc. So this makes the 5. This makes totally the Dasha Vayus. And they have mentioned the Adharas, that is similar to our Shat Chakras, that is Mooladhara, Swadhisthana, etc. And they have mentioned Nadis. Nadis are nothing but the similar to our Srotasas. They have mentioned 12 Nadis. So these are the basic physiological or the functional philosophical aspects of Varma Shastra. Now, if we see the treatment aspects, that is the management or the manipulation techniques, they have mentioned this Padi Kanakku, Matrai Kanakku, Kai Bhagam, and Sai Bhagam. Matrai Kanakku or the Padi Kanakku is nothing but the it denotes the quantum of or the measurement of how much pressure has to be given. That is, they have mentioned 1/4 Matrai, or 1/2 Matrai, or 3/4 Matrai, or 1 Matrai. That is the pressure given towards one Varma point for its simulation. That is specifically mentioned as if we just press it from our finger, the pressure is only from the finger, it is Kal Matrai. If it is pressure coming from the wrist joint, then it is that is the 1/2 Matrai. And if it is pressure is coming from the arm, it is 3/4 Matrai. And the pressure is coming from the shoulder joint, that is the entire force is coming over that point, it is the 1 Matrai. So based upon that, it is classified. And the Kai Bhagam and Sai Bhagam. Kai Bhagam is nothing but the different, that is the methods of stimulation. For example, the method of stimulation of Varma in circular manner, or in the case of anti-clockwise manner, in clockwise manner, just like that. And then that is the just by touching itself it gets stimulated. So that is called as Kai Bhagam. Sai Bhagam is different types of applications of Marma. That is Varma manipulations. They have mentioned 12 types of Varma applications. That is just like that is the tapping the Marma, or just pinching the Marma, or just holding the Marmas. So these are called as Sai Bhagam. So this is a manipulation technique which is mentioned in Varma Shastra. So they have mentioned the Adangal and Tiruvukol. Adangal is nothing but it is that is 110 Adangal is told. This is nothing but the techniques to revive the patient who is in an unconscious state. That is because of any Marma Abhigada, the patient may be in unconscious state. So to revive those patient, Adangal is done. Even if Adangal is done, the patient is not getting revived or is not getting his consciousness, then the procedures like Tiruvukol is done. Tiruvukol, there are 12 numbers of Tiruvukol. So this is the basic idea of Varma Shastra. Now, if we see about the Kulayana Varma Shastra or the Kulayana Marma system, which is related to the Kalari, it was started in the 5th century AD. So it was widely classified as 2 traditions. That is the northern style and the southern style, which is nothing but the northern part of Kerala, which is and also which is practiced in the southern part of Kerala. So the northern tradition, that is the Kalari, which is practiced in the northern part of Kerala, takes as a pan-Indian origin. But it is taking its origin from Kashmir, and it travels to the Tulu origin, and it has come to the northern part of Kerala. Whereas the southern tradition of Kalari has its origin from the Dravidian part, that is from the Tamil Nadu, or from the there is the Kanyakumari part of Tamil Nadu. And so it is the northern part of tradition, it is they usually worship Parashurama, whereas the southern tradition usually worship Agastya or the Shiva. Next, the Kalari Marma Chikitsa initially, which was developed, as I told, in the 5th century AD, it was regarded as a primary emergency management modality. That is initially because when people get sprain or get any fractures, they initially go to this Marma Vaidyas or the Marma practitioners, whom they do these manipulations or bandages or lebanas, and they treat this that is, they treat the patients. So it was initially it was a primary emergency management strategy prevailing in ancient Kerala. Now, when we see the curriculum of this Kalari, it is almost related or closely related to Ayurveda. That is, all these students will be learning some chapters of Ashtanga Hridayam also, and apart from that, they will be learning certain other literatures related to medical science, and they have a very systemic or a very organized massaging technique that is called as a traditional Kalari massage or Kalari Udichal Sampradaya. So they have a very compromised, organized technique, and this training is also very organized. That is, initially the student who comes for this Kalari training, he will be trained in this massage technique for for a few years, and then he will be given a patient to him to practice. First, he will be trained with hand, and finally, if he gets trained with the hand, he will be trained the Pada Gadam, that is the Pada Abhyanga, or the massage with the foot. And after this, he will be doing on the patients. So it has a very systemic or systemized way of teaching Kalari Udichal, and it is the Samsajana Karmas or the Patyas which is mentioned as per Ayurveda. There is Snehapana Patya is also mentioned in the Kalari Udichal. That is, they have to undergo all these Patyas for the 7 days or 14 days, and after that, the patient will undergo Virejana or the Shodhana procedure. Now, if we see the Kalari Marma system, it has given a detailed inscriptions of the location of Marma. They have given the different measurements of the Marma, that is the actual Marma. They have given the actual measurement of this Marma, and they have mentioned the part to be used. That is, which part of the hand which can be used for inflict injury over the Marma point, and what is the effect of this Marma injury, and finally how it can be revived. That is called as Marukai, or the counter application to rectify this damage caused by the injury of the Marma. So, and also they have also mentioned the time frame within which this Marugai or the counter application has to be done. So once all this has been learnt, then the Kalari practitioner will be given training in a specific that is a weapon called a Ottakol. You can see the picture here. This is called Ottakol. You can see the shape of this Ottakol. That is, it is specifically designed to inflict injury over special Marma points. So this is finally it is given to a Kalari practitioner or a Kalari student even after getting trained in sharp instruments. That is, after getting trained in the swords, getting trained in the axes, etc. After getting trained from the sharp instruments, they will be trained in this Ottakol. That is, this Ottakol is a very easy method of creating injury over the specific vital points. Now, after this, they will be trained in Verumkai. Verumkai is, that is, they will be trained in the bare hands. That is, how to inflict injuries in the bare hands. So this is the comprehensive Kalari Marma system. Now, in Kalari Marma, they have classified the Marma points as Kula Marma, Kocha Marma, and Abhyasa Marma. That is, Kula Marma is nothing but the Marma points which when they get injured causes instantaneous death. That is, it is similar to our Sadhya Pranahara Marma. Next, Kocha Marma, it is when this Marma get injured, it can cause severe internal hemorrhage, and because of this, the patient may get unconscious, and if he is not revived at timely, he becomes unconscious. So this is similar to our Kalantara Pranahara Marma. Now, the Abhyasa Marma, which is mentioned in Kalari, that is, it can cause, that is, when this Marma is injured, then the patient will have certain deformities. So it can be related to our Vaikalika Marma. So this is the basic classification of Kalari Marmas. Now, different strategies of treatment strategies are mentioned in Kalari Marmas. That is, as I told earlier, they have a very comprehensive massaging technique called Urichal that is done with both hand and the feet. Now, they are also having a treatment procedures called Potali, that is which is the Kiri procedures or the Svedana procedures which are mentioned in Ayurveda, like our the Patra Potra Svedana, etc. They have Manjal Kiri or Elakiri. Manjal Kiri is nothing but a combination of turmeric powder with many medicines. It is specifically done in the conditions of, for example, in hard inflammations, or in the case of post-immobilization stiffness, or in the case of cervical spondylosis, etc. This Manjal Kiri is done. And in the case of rheumatic diseases or degenerative conditions, they will do Elakiri. Elakiri is nothing but combination of different patras, that is the leaves of different that is herbs are used. This is called Elakiri. It is similar to our Patra Potala Sveda, and they have different types of bandages with the various medicines. So these are the various famous Kalari yogas which are used commonly. That is the Kshadantaka Tailam. Examples are few mentioned here. Kshadantaka Tailam, which is similar to our Muruvanna, what we use. It is in our Ayurveda. It is used in acute inflammation conditions. And Medugu Tailam, which is similar in preparation of our Pinda Tailam. It is used in post-immobilization, stiffness, etc. And Mahanari Tailam or Siddharthaka Tailam, which is similar to our Mahanarayana Tailam, which is used in degenerative conditions or radicalopathies or any type of musculoskeletal disorders. And they have a special preparation called Kalari Mukkutu. Mukkutu is nothing but a combination of three tailas. That is what in Thiruvananthapuram, which is mentioned in Ayurveda. It is a combination of three tailas and many other medicines. It is used for strengthening the bones, joints, ligaments, etc. And they have different types of Marma Guligas also. These Marma Guligas are used for Lepana and for bandaging procedures in case of sprain or in case of fractures, etc. or in ligament tears. Now, they have similar to our Panchasneham, they have Chadusnehas, which is specifically indicated for Avabahugam, etc. conditions. And they have a special preparation called Ajalyadi Guliga, which is similar to our Dhanvantari Guliga. That is, it is used for treating Vayuk Shobha. Now, so what is the Marma Chikitsa's current scenario? If we see that, then we can say that there are very, density of practitioners high in the southern part of India. Southern part of India, especially in Tamil Nadu, Kanyakumari, that is the southern districts of Tamil Nadu, and also in Kerala. We have very high density of practitioners, and this Tamil Varma system has gained wide popularity because of more practitioners in that field, and because of more institutions giving training to this to the graduates, and also many researchers are undergoing these institutes. And we have a Kalari system has retained this traditional flow of knowledge and has started to flourish. The past, that is after post-independence, it started to flourish, and further the system has discovered new inroads in sports medicines also in nowadays. Whereas an Ayurvedic Marma system is now showing a lease of life. That is, this platform is also one of the examples for that, and also many research documentation, like the documentations of underwent in our CCRS. So all these are nothing but the reviving of Ayurvedic Marma system. So, but still we are, it is in a nascent state. It needs to grow to a greater heights to become a part of our mainstream Ayurveda. Now, various types of management in current scenario in Ayurvedic Marma Chikitsa, we use various type of manipulation, that is massaging techniques, etc. Apart from that, we are using bandages, lepanas, daras, abhyanga, and there is certain practitioners using Agnikarma also, Siravedanam also in Marma Chikitsa. But unfortunately, there are very few research activities undergoing, very few clinical research activities are going, very few clinical trials are going on. And so this is very, very unfortunate to this science. And we see the publications are also very few in this science. Now, if you see the strength in Marma Chikitsa, it is a complete science. That is, it is having its own basic philosophical fundamental base. So it is regarded as a complete science. It is having its own pathological aspect. It is having its own the treatment aspect. So it can be regarded as a complete science. Yeah, that is, it is having a common philosophical background with other Ayush systems. We can, that is, we can integrate with other Ayush systems like yoga. Okay, so it can integrately, it can develop. Now, it can be used as it can be used as a standalone also in certain diseases, or it can be used as an adjuvant treatment with our Panchakarma treatments, etc. Now, it is also effective in, we are seeing in our practice, it is very effective in a larger spectrum of diseases. Few of them examples are musculoskeletal disorders like our radiculopathies and the like lumbar radiculopathy, cervical radiculopathies, and different types of neuropathies, neurological conditions, paralysis, neuromuscular conditions like DMD, motor neuron diseases, and several, the myelopathy conditions, and several types of metabolic disorders like diabetes, hypothyroidism. All these are gaining, that is nowadays Marma Chikitsa are done in practice, and they are very effective, and they are very found to be very effective also. So when we see this Marma Chikitsa, it is very simple, it is painless, it gives quick results, that is immediate result to the patient, and is very cost effective also, because in most of the cases very less drug is used. So it reduces the burden of medications. So it is very cost effective to the patient. Now it is having a very the Marma Chikitsa is, or the Varma Chikitsa mentioned in Tamil language, is having very rich literature, many manuscripts, even thousands of literatures, manuscripts, that is the palm script manuscripts are available in Tamil Nadu. So it is having a very rich literature also. But unfortunately, this Shastra is having few weaknesses also. That is, there are a lack of standardization of points. That is, what is the specific, where the identification of specific Marma points are. There is need of standardization of stimulated in clockwise, anti-clockwise. All these has to be standardized. So there is lack of standardization of all these techniques, and there is it requires this Shastra. It requires strict discipline from the part of the student to learn the science. So it is very difficult to learn without this strict discipline. And if it is done in a wrong way, that is, if it is done wrongly, it can cause very dangerous effect to the patient. And unfortunately, very few experts are available in this field. And because of the very few experts are available, the sharing of the thoughts of this great science is also very less now. So this is the main weakness now we are feeling, or way there is a main what is the pulling the science backward. And this literature available, it is very available only to few languages. That is, for example, in Tamil only it is more literatures are available, very few available in Malayalam also. But I think it is in other Indian languages, it is very few. And it lacks scientific evidence, and less publications are there. So these are the various drawbacks or weakness of this Shastra. But this is not only, this is, we cannot say the weakness of the Shastra, it is, I think it is weakness which was caused by the time, and it is mainly because of the weakness of the present day Ayurvedic fraternity. Now, what is the future ahead of this Shastra is, we have to find out new indications of various Marma techniques. So we have to open the window of Marma Chikitsa, and we have to find new indications. As I told earlier, it is we have to do in certain in sports medicines, or in the case of neuromuscular disorders, rehabilitation medicine, etc. And it is mostly drugless. Very few drugs are used in this treatment. Hence, it is very easy to introduce in our healthcare system. And it is, as the philosophical and the fundamental basic are similar to other Ayush systems. The integration is very easy, so it can be integrated with other Ayush systems. And there are new windows of scope in this science. There is the sports medicine is there, and there is emergency medicine, rehabilitation medicine, and personal. So we have to find out the scope of Marma Chikitsa in these various areas like sports medicine, emergency medicine, etc. And we can develop new drug delivery forms of these Marma formulations. So for example, we can make it we can innovate these Marma formulations and make sprays, and we can innovate the lepas as paste applications, etc. And we can explore the scope of Marma in anesthesias. in local anesthesia like that we can which can be used in our parasurgical or surgical procedures, and we can innovate our certain procedures which are available in Ayurveda. We can innovate them. That is, for example, Abhyanga, we can innovate our procedures through using this Marma Chikitsa techniques. So finally, this is the publication we have done after our long 2 years, 3 years of documentation. This is available in all CCRA's institutes. This is Marma Chikitsa, Basic Tenets in Ayurveda and Therapeutic Approaches. So as I told earlier in the first, in the introduction part, that is whatever I shared in this session, it is all the knowledge which I gained from this documentation, and it is available in this book. So you can also go through this wonderful book, and it is available in all CCRA's institutes. And finally, I want to thank our present DG, Rabindranath Acharyan sir, and also our later DG, Bhiman sir, who was involved in this, who helped in this documentation, and Srikanth sir, who is the DDG of CCRAs, and director of NRIP, assistant directors and other staffs of NRIP, and also my colleagues, research officers in NRIP, and also my colleagues, especially Rakesh Narayan in CCRA headquarters, and also Dr. Praveen from Guwahati. I want to thank each one of the people, and also I want to thank all the Marma practitioners who are involved in this documentation and who is still practicing this great science, and who is maintaining this great science, and what to say, protecting this great science, and giving knowledge to their traditions. So once again, finally, pranamam to this great acharyas of Marma practitioners. And finally, I want to thank each one of you for your patient attention and patient listening. So if you have any doubts, you can put forward. Thank you. Thank you very much.
Thank you very much, sir. I think you have given a very good lecture on all the prospects about the Marma. We being in Ayurveda, we're not so conscious about the different type of things which are already prevalent in our Shastra, which can be quoted under the heading of Marma Therapy or Marma Chikitsa. So thank you very much, sir. We are having one question for you specifically from our director, madam. Please give an example on Udavartan. All the prospects about the Marma. Please give an example on the Udavartan and Gharsan to differentiate its karma on Marma.
Yeah, no, thank you, madam. Thank you for your, because your patient hearing also, first of all. So, you were asking about, that is the, sir, can you repeat the question? I didn't get that.
Sir,
two procedures.
Dr. Gaurav, can I ask?
Yeah.
Can I
Yes,
ask?
sir. Yes, sir.
Sir, we understand Udvartana to rub something like churnas on the skin, and Gharshana, where we can just, again, Gharshana is also friction on the skin.
Yeah.
Okay, sir. So in Kushta and all, Gharshana is also advised. But I want to know how and what is exactly used for Udvartana and Gharshana in case of Marma, and how it is going to help the situation. If you can give me an example with some disease. Yeah,
surely, madam, because Udvartana is a very familiar procedure which we are following in Panchakarma. In our institute, we practice this Udvartanam very in a systematic way. So Udvartana is as not only in Marma's perspective, it is used in all types of neurological conditions. It is, as to my knowledge, it is specifically responsible for energizing or rejuvenating the peripheral nervous system. That is the rubbing of this powder, because it is based upon the base is nothing but a powder, or it can be mixed with a oil. That is nothing but the Udvartana. So it can be called as Utsadhana also. So when it is a plain powder, it is called Udvartana, or it is mixed with any oil, it is called as Utsadhana. So both can be done in the same condition. It is mainly, I think, it is related to a peripheral region. That is, it can stimulate the peripheral nerves. So it is highly useful in peripheral nerve damages. For example, we have very good improvement in peripheral injuries like the ulnar nerve injuries, or the injury to the common peroneal nerve, foot drops, or if it is an injury to spinal cord injuries. For example, if it is in the spinal cord injury, it is initially it causes severe spasm of the body. That is, there will be a lower motor neuron lesion, there will be a caudal hemiplegia, so there will be a severe spasm in the lower part of the body. So in that initial phase, if you are doing Udvartanam, it gives us immediate effect to the patient. The patient will have immediate effect, and also the sensory pathways are stimulated by Udvartanam. And in the case of Garshanam is, there are, as you mentioned, there is Garshanam which is mentioned in an Ayurvedic text. It is a slight, not much pressure is required as in disease of skin. For example, in Kushta it is mentioned, I think it is in Leukoderma it is mentioned.
Yes.
So in those conditions where there is, the skin has to be rubbed, and we have to get certain amount of rubbing over the part, and the upper part of the skin has to be stimulated. The certain neurons which are located in the skin has to be stimulated. The blood circulation in the peripheral skin has to be stimulated. So in those conditions, and specifically as the Garshana method or the Udgarshana method which is mentioned in Marma, it is done in the direction of the blood circulation. That is, it is done, for example, in the arterial, to improve the arterial circulation, it is done from as per the arterial blood circulation way, that is from up to down. If it is the venous, we have to stimulate the venous circulation, it is done from down to up. So I think it is based upon this differentiation we can utilize Udvartanam and Garshanam. Hope I am clear, madam?
Oh, thank you, sir. Thank you.
Yeah.
Sir, I am having also one query. That
Sure.
if we simply go for that Marma therapy, which is more prevalent, that we are going to press certain points. So
Yeah.
how to understand how much pressure we have to put on a particular point so that a patient doesn't feel too much painful also, it is tenderness, or it will be easy for us to do also. Means what will be the specific point we can understand, how to understand the pressure we have to apply.
Yeah, that is a very important question, sir, because the application is very important here, because if the pressure is more, because as such mentioned in my session, that is, it is mentioned in the Marma points are located in the Madhyama Roga Margas, especially in Sera and Snayu. So if we give a very deep pressure, we give very deep pressure over the vital points, then there is a chance for injury to these vital points. So the pressure points, as mentioned very much, the pressure points which are, that is the quantum of pressure is not that much mentioned in Ayurvedic text, but it is available in this Varma Shastra, sir. In Varma, that is the text of Varma Shastra, as I told, that is they have mentioned the Padi Kanakku or the Matra Kanakku, but all these are depend upon the different types of diseases and different types of various Marma locations. That is, in certain Marma points, only half Matra has to be done. In certain Marma points, one Matra can be done. In certain Marma points, there is very subtle Marma points, we have to do only that is 1/4 Matra. But how to standardize this Marma, the quantum of pressure is, as I told, that is the main lacuna of this science. It is, it is orally transferred and it is practically transferred to the student. That is, the teacher shows himself to the patient, to the student. That is how much pressure has to be done. So it has to be hands-on training has to be given to the student. So that in that way only we can learn how much pressure has to be given. So simply, as I told, sir, that is, if you are giving pressure only to our finger, through our fingers, then it is a kal matra, it is 1/4. If you are giving a pressure through our entire limb, then it is 1 matra. So that is, if we are giving that whole pressure, so that may be required if it is the Marma is if it is present of that is 5 angulas like that. So that much, if it is deeply located, we have to give that much pressure. So pressure and learning of that pressure has to be standardized, but it has to be learnt from hands-on training only. So it cannot be described or it cannot be showed through a video. It has to be felt only, sir. That is the way we have to learn.
Sir, I'm also
Yes, sir.
having one question, sir.
Yes, sir. Yes, sir.
Yes, my question is that is there any contraindications where we should not do the Marma therapy? Suppose any patient comes with a sprain immediately, so shall we do it at at the time of injury just now when the patient come, or we should wait for few times to let that injury settle down? Or so is there any contraindication where we should avoid this Marma therapy? Is there something?
Yeah, sure, sir, sure, sir. There are contraindications, very much contraindications are there. And that is usually in that is the Marma stimulations, especially Marma manipulations, should not be done in immediate injuries. That is, but in certain revival procedures like the Adangal or the Marukai, which is told in Kalari, the Adangal techniques which are told in Varma Shastra, it has to be done in acute phase. But in the case of acute inflammations, the certain Marma techniques, that is manipulations, mostly should be avoided. That is, it may cause, for example, in the case of fractures, we don't know that is if the fracture has happened or not. So if there is if a patient comes with an injury, we don't know what is the fracture, the underlying fracture has happened or not. But if we are giving that much pressure, or we are not we are mobilizing that part, then it can cause a very fatal to the condition. So we have to so usually in an acute injury, if it is that apart from Adangal or Marugai, which is mentioned in Kalari Chikitsa, better to avoid this manipulation techniques. But we can do simple application like tape, which I mentioned in Abhyanga technique. Tape, just application of oil or application of lebanas can be done. Application of Marma Guliga can be done. Guliga lebanas can be done, and the bandages technique can be done, or the Dhara procedures like pouring of kashayas, pouring of kshira, and pouring of medicated kshiras, pouring of medicated oils. So all these can be done in the initial phase. So in acute inflammation condition, better to avoid the other manipulation techniques. Hope, I think Gowthaman sir will be dealing about all these things.
Okay, thank you, sir. Thank you very much, sir. I think topic is very elaborative. Too many questions, too many discussions are needed, which will be dealt in future webinars and workshops, which will be done by the institute. So let us move to the next lecture due to time foundation. If anybody is having any query, they can send in the chat box or directly in the Google Meet chat box. We will further forward them to the respected experts so that we can get the answer in our next lecture series. So thank you very much, Pratap sir. Kindly, those who have joined, kindly mute your microphones. So now I welcome Dr. Gowthaman R. sir. Sir, are you here? Dr. Gowthaman,
Yes,
sir?
I'm here, yes.
Okay, sir. Kindly open your video also, sir. Yes. Okay. Welcome, sir. I will give you a short info about the sir. Sir is Dr. Gowthaman R. sir. He is a practitioner, Madhava Matam, CBN Kalari Ayurvedic Center in Kerala. Sir has been practicing Ayurveda doctor, has also pursued MD in the Ras Chikitsa or Ras Shastra for the upgradation of his knowledge. He has initiated in the world of Kalyapayatu by his own father at very young age of 7. So from childhood only he is knowing this particular traditional skill of Kalari Varma. So sir has continued to upgrade himself on the hidden vistas of Indian medicine, and now it's upholding this particular traditional knowledge via his own Gurukul system. Sir has done MD from the Government Ayurvedic College, Kerala. He has a specialty in the Kalari Marma Chikitsa, Ras Chikitsa. He has been a resource person, has conducted many classes on the Kalari Patru and Yoga for Indian System of Medicine, Government of Kerala. Also has been resource person on the subject of Marma Chikitsa, International Ayush Conclave 2019. Has been lead performance in Sri Lanka under ICCR Ministry of External Affairs, Government of India 2013. Lead performance in the Saudi Arabia under the Department of Cultural, Government of Kerala 2019. Resource person in the certificate course on Marma Chikitsa by CCR Department of Ayush, Government of India. M panel under ICCR Ministry of External Affairs, Government of India, and affiliated to Sangeet Nat Academy, New Delhi for training theatre student on piety and it is. So many more prospects we are going to hear from sir directly. Sir is going to give his views on the clinical aspect of Marma, especially the Kalari Marma, and how we are going to use them in our modern prospects. So handing over to sir.
Okay, good afternoon, everybody. And first of all, I like to convey my thanks to Dr. Nida ma'am, who is the director of the institute. Namaste ma'am. And Dr. Alok and Dr. Gaurav, who is coordinating this webinar regarding, I think, Shalya Tantra department and Rachna Shalya department. Actually, I was introduced to this system through my family. It's already mentioned in the biodata was explained by the coordinator. So the system itself is established in Kerala. Now it is likely to be getting accepted by the vistas of Ayurveda. That's what's happening now. And while going through the presentation, we can say about the different aspects of Kalari, how it is working over, along with the systems of Ayurveda. Okay, sir, can we start the presentation?
Yes, sir.
Okay. Is it visible, sir?
No, sir. Right now, it's not visible.
Is it visible now?
No, sir.
No. Just a minute.
Oh.
Sir, please open a new tab and then share your whole screen so that it will be visible.
Yeah, just a minute. Something. It's not working. Just a minute, sir.
You can disconnect and connect again, sir.
Yeah.
Yes.
Dr. Gaurav, please unmute him. I think, sir,
Sir is already unmuted from my side.
okay, okay, okay.
Me?
Sir, you are unmuted. But slide is not visible.
Okay. No, you can see here too. Yes?
Yes, yes. Coming.
Okay, fine.
So put on the PPT format,
Yeah.
presentation formats. It's very small.
Okay.
No, no, it's still small, sir.
Sites look very small. Please keep in on the
Oh.
slide mode.
Present slide mode, sir.
Just keep. Just click over the slide presentation mode, sir.
So on the lower side, this one. You just click this point. Yes, sir. Now it's okay.
Okay.
You can go on first slide now.
Okay.
First slide is not visible, sir. You go on the first slide, title slide.
Is it visible now?
So it's visible, but only this one is the third slide. Start from the first slide, please, sir.
Go on.
Excuse me.
Yes, yes. Move, now move one more up, sir. Yes, now it's visible. You have done 142%. Give it to 100%. I think, na? It's okay. It's okay, sir. Okay, fine, sir.
It's okay.
You can start, sir. Yes, sir. You can start.
Okay. Now we go through the contents. I think it's audible.
But one request is there that you put like it is more than 100%, 140% it's expanded.
Okay.
Put it at 100%, sir. Yes.
Okay, I will.
Keep it 100 and then in the presentation mode, sir.
It's in presentation mode. I don't know why it is visible like that.
Yeah, just click here. Just click here. Click.
Is it visible now?
Sir,
it's visible, sir. It's visible.
Just to reduce.
But is it too much expanded, sir?
Okay.
You have to minimize it a little bit. Yes, it's 220%. Now it is too
I will
like
put
this.
in
Sir.
100%.
Yes, sir. Yes, sir.
Is it okay?
Yeah, it's okay, sir.
Now put on the presentation mode. Yes, sir.
Okay.
Okay,
Okay, sir.
sir.
Fine,
Start.
sir. Okay, start. You can start, sir.
Okay, these are the points we are going to discuss about Kalari as a martial art, Marma in Ayurveda, and we are comparing it with the Marma in Kalari Chikitsa, and the principles what we are following in Marma Chikitsa regarding Kalari Paitu, and approach of Kalari Chikitsa in general health. And finally, we will go for a conclusion. Kalari as a martial art. We know like every martial art is developed in a regional form to protect the people in a particular area or in a particular country. I say India is a large country. We know before independence or before.
Sorry to interrupt you, sir. Sorry to interrupt you, sir. It's fourth slide which is visible right now. It's fourth, not first.
I don't know what's happening. Just a minute. I will go through this one. Now you
yes,
can.
Sir, okay.
It will be
yes,
enough.
Yes, sir.
It's enough.
Yes, sir. Okay. Yes,
we
fine, sir.
This, okay. I think some happened with the software. I think hope so. You want me to change it in your presentation mode, or I can continue like this?
If you can, it's okay. It's visible now, sir.
Okay, fine.
You can continue.
Yeah. Kalari is a martial art. It's developed in Kerela. It is having a history. It was propagated by Parashurama, who is coming from northern Kerala. Actually, it was the basic concept of Kalari itself from the taken from the Ayurveda. Part of Kalari for the protecting of the land and people, along with the martial art, Parashurama propagated treatment methods also. Whenever you get an injury during the practice or while handling weapons or anything, there's a chance of injury like a wound or like a Marma Bigada, then you are supposed to treat it. So the trainers or Gurukul who is running the Kalari should be having a thorough knowledge of anatomy as well as the Marma points, and he should be able to prepare his own medicines to handle the patients. That's the concept. And Kalari like other martial arts, is a concept is to gain strength of the body and concentration of the mind. Because previous time before Britishers came for the inversions, Kerala itself was divided into like 3 areas, Venada, Maladada, like that. There will be like a feudal system where local empires are there, small empires. They run their own Kalari like a recruiting center for army. Because those who are able to join army, they will be getting training in the Kalari, and they'll be directly recruited from those Kalaris to the army of the feudal lords. That was happened at the 18th century. Later, it was when the Britishers came. We know in every part of India it happened. They tried to ban the Kalari and Kalari like martial arts, and they stopped running the Kalari. Along with the stoppage of Kalari as a martial art, there was a decline happened for the Marma Chikitsa system also. But after independence, it regained its time period, because many families they withheld their system of training without knowledge of the people, and later after getting independence they start to reproduce it. Care and cure, that was the concept. Care is for the as a human purpose. We are supposed, those who are training in Kalari should care their self, and when there is an injury came from Kalari or from outside as any patients, you are supposed to have a cure facility also. Spirituality, as every system of Bharata, we know there will be a pathway towards spirituality. In Kalari also we have a pathway of spirituality. Why? Because we teach Kalari in a particular place, Kalari Paitu in a particular place, which was we have some deities to do the pujas. It's similar like a temple concept. Meitari, Koltari, and Agatari. This is a transformation of a student. Like we will train a student in the body flexibility exercises. Then we train them handling wooden weapons. Then we train them for handling metallic weapons. Then they will be trained for the Marma techniques using bare hands. This is the transformation of a normal man to a Marma specialist, because whenever you go through these procedures, you will you will identify the points where you will be getting to the Marma points than the normal areas in the human body. This is the transformation happening. And physical culture. As a physical culture, when we go through the Kalari system, we have a daily Abhyangam. We know in Dinacharya, Abhyangam is mentioned as a important thing, because it will increase your body strength throughout the body. When you apply oil to ear, pada, everything have a different effect. Same way in Kalari also, even the students also supposed to enter the Kalari and start their practice after Abhyanga by their own self. Then for body flexibility, and we are making them more flexible, there is another treatment called Ulch that we discuss in the end of the session. Stamina and strength is very important for a Kalari practitioner as well as a Kalari Gurukul, because when you have the enough stamina and strength, then only you are supposed to do some maneuvers and original treatment, and everything is related to the physical stability and physical ability of the Marma specialist. Exercise itself a treatment modality in Ayurveda and Agnes Vedam. I think doctors, everybody know, because when you go through the Sweda method, the medas will be reduced, and it itself as a treatment modality we can follow to prevent so many diseases. Marmas in Ayurveda that you all know. Just for the classification, we are mentioned and we are taught in the basic studies as like as 107 Marmas, regional classifications, structural classifications, and Vyabhat Vedana, Mana Vedana, and Sangya Vedana. Each and every classification is, Shagagada Marmas, Koshagada Marmas. That I don't want to explain too much. Now we go to the topic Marma in Kalari Paitu. We know why it is called Marma. Mare the Marma, or it's a common definition given to Marma, because it can even produce death. Even produce death, it should be until, because it's a highest expected potency of a Marma is going to death, like Sadhya Pranahara or Kalandar Pranahara. If Pranaharitva, it's when we take it out. Rest of them, there are so many points in especially Shagagada Varmas and Koshtagada Varmas. When we see, it will be having a specific effect in the body that will make a man maybe unconsciousness or a painful condition which he can tolerate. That intensive pain with a temporary disability or severe damage with a generalized effect, that can be expected when you get an injury. If some points are identified, even by a normal person, when we met an injury like a fell down or by a road accident, RTA, then there is a chance of what we are trying to get is if there is a Marma Bigada is there or not. To identify that, you should be able to, you are supposed to know the specific points of Marma. Marma points in Kalari. There are 64 numbers we are explaining in Kalari, which was 37 in numbers, but like a multiplication, 2 Marmas. When we go for Chagas, there will be 2 in numbers. Then it will be the total count will be 64. Instead of what we are studying in Ayurveda, it's 107. There will be a similar points are there, but it was called or explained in a different names. That's it. Kula Abhyasa Marma and Coach Marma. These are the different classifications given in Kalari Marma Chikitsa. Instead of having like Sadhya Pranahara, Kalandra Pranahara, we are giving the classification like Kula Marma, Abhyasa Marma, and Coach Marma. Coach Marma is the, for example, I can say Coach Marma, the name itself, Coach in Malayalam is like a what we can get cramps. When some marmas are injured, you will be getting severe cramps, and you are supposed to identify that marma, and you have to go for a counter manipulation method. And in Marma, Kalari system is more based on Nadi Sharira. And it is always mentioned that prana is vitiated. It's a concept same as Ayurveda that when you get the marma points, which is it's a junction of marma snayu, mamsa asti snayu, everything is like a junction, we can imagine like that. And where it's like a switching point of prana, when you get an injury, there will be a generalized effect, maybe a localized effect. Depends on upon the intensity of the prana which is hiding over the particular place. Now we just go through the few points in one or like chest, hands, and lower abdomen, everything. Marmas on chest: Lohida, Rectum Tuppi, Shwasamadapan, Eda, Pingala, Trishangu Pushpam. These are the names mentioned in Kalari system which have some similarity to our Ayurveda marmas. Lohida, we can Rectum Tuppi is Recta itself is like blood. Lohida is also regarding blood. Both these marmas are in the chest, similar to what we can say Sthana Lohida, for example. It's not the particular area what is mentioned in Ayurveda, but it is nearby. That area, when you get an injury, there is a chance of spitting of blood. Then you have to identify that injury by the symptoms exhibited by the patient. Usually, when a patient comes to you like an acute injury after a incident of hitting at the he get a hit at the chest. When you approach then you have to check it whether there is an injury to the chest with a cough along with a spitting of blood. Then you have to identify whether there is a history, like when you go for the history, any other illness is there. If it is not, then you can identify it as a marma injury. It's always regarding the history taking. Ida Bingala Trishangu Pushpam is also very dangerous marmas. Why I put it in red marks? Why? Because it's Sadhya Pranahara marmas, and it's a concept of Kalari Marma Chikitsa. When we come to the marma treatment in Kalari Chikitsa, usually the counter rotation will be in the opposite side. Usually there will be a small counter application in the localized area in the chest, and the more application will be on the opposite part. That's why usually in scapular region, in between the scapula, in the scapular region, at the top of the scapular regions, these are the areas where we concentrate, and there are particular points which is just opposite to these marma points where the counter rotation or counter manipulations are done. Marmas of abdomen: Jalabandam, Rektabandam, Malabandam. These are the 3 points we mentioned. Is Jalabandam means which more related to the bladder, urinary bladder. Rektabandam, there is a chance of urination and defecation with blood. Malabandam is a defecation which is uncontrolled sphincter. These can be happened when you get an abdominal injury or abdominal hit. It's also identified by the by asking the type of accident what is happened, or the type of injury which is got by the patient. Okay, massage on the lower back. This is also controlled, like when you take the concept of nadis, we go for Muladhara chakra. We can there's a concept that Muladhara chakra is having spiral energy which is radiating towards the more control over the nadi and the abdominal area. So when you manipulate some techniques or massage in a particular way, then you can control these symptoms, like when the uncontrolled defecation or uncontrolled urination is happened, then you are supposed to go for the counter correction techniques in the lower abdomen towards the lower back. Now we go for the marmas on genital area. These are some I think many of them know. When you get the testicles are injured, or when you get an injury at the testicles, you are supposed to be hit on the head. That's a usual technique what generally follows, but sometimes it will be more complicated. Sometimes you will be having a loss, he are not supposed to breathe, or not even to lie down, or with fainting. These conditions will be handled in a particular manner, which have to be controlled by 3 areas. You have to massage head as well as the lower back, and you have to tap in a particular and squeeze it down to bring the testicles back. These are the techniques you have to take into consideration very carefully, because Abana, Vrigalam and Amuka, these 3 marmas are very contagious, and even it can goes to impotency in future. Marmas in extremities. Kurcham is a marma which is more related to Chipram in Ayurveda. When you are getting injured, there is a counter rotation. You can go for the massaging the little finger. Phanam is a particular marma which is located in the axillary region, axilla. Then you get injured, there will be difficulty in movement of the hands. Then you are supposed to go for stretching of the hands in a particular manner to regain the flexibility of the hand. Nadadalarpan is also a particular marma which is mentioned in the legs. When it is got injured, you will not supposed to walk. There will be a limping of gait. Marmas on back. Back, especially I mentioned it's the upper back. Kaluthu gochi. Kalutha in Malayalam itself is neck. These marmas are more concentrated when you get a neck sprain. Just for an information, I am saying these are the marma points mentioned in Kalari Marma Shastra is to injure a person actually. It's to, because when you are barehanded, something happened to you, somebody is attacking you, then you are supposed to find the weak point of a enemy. Then you are have to do some marma application to make you you are supposed to escape from him. That's a concept where the marma is explained in Kalari. Later the system changed, because when you get some injuries, when you get the injuries and the normal person is getting an injury and coming to you, how you can use the knowledge of marma in treating a case. That was happened in the later period of establishment. So these Kaluthugochi type of marmas are used for the general purpose of treatment. When you get a sprain of the neck, or even Nadadalarpan, some marmas in the legs are manipulated to regain strength of the, or cure the sprains of the leg also. These are the conditions where we are adopting the technique from the martial art field to the normal treatment protocol. Marugai or Pradividi. These are the techniques usually used in counter rotation or counter procedures for a Marma Bigada. Tapping, there will be a particular way of tapping an area, twisting of particular areas. Even when it is coming to Shaga Varmas, we go for some twistings, stretchings. and pointing. Pointing means giving pressure with the finger or even with a big toe. You can go for a pressure, and beating. Particular way of giving a beat on a particular area will stimulate the prana at that area to counter. It's like a counter rotation to a injury of the marma. Kula marma, for example, some marmas are mentioned here. Trishangu pushpa. Trishangu pushpa is a marma which is located in chest, which can be at the end of manubrium sternum, what we can assess. You have to, when it is injured, you have to assess it with some symptoms, and you have to beat in the area which is just opposite of that area, that is Prishtavancha. You have to identify the same opposite area, and you have to go for a tap. Udanan is also a particular marma which is the upper chest, and you have to go for a manipulation in the neck. Kochu marma, left lower abdomen. Jalabandam, Malabandam, that we already explained. You have to go for a massaging technique in the lower hip. Knee joints, it's similar like causing a limping of the leg. Then you are how to massage the both. The manipulation will be at the both sides of the knee joint. Abhyasa marma, Chipram, it's already mentioned. Changu pushpam is just opposite. It's like when you get an injury to Changu pushpam. Changu pushpam is just opposite to Trishangu pushpa, where the manipulation of Trishangu pushpa's injuries happened. But when Changu pushpa is injured, it's like some injuries in the spine. You are supposed to hang the patient in a kacha. Kacha is a long cloth what we use in Kalari. You have to hang the patient with the help of another bystander also, and you have to go for some manipulation by crossing the legs. I know it's very difficult to understand by hearing me. In the end of the session, I will try to show you some videos when you can get it more clear. Kalari Chikitsa itself is an established system in Kerala, developed by traditional martial art practitioners. Because, Kerala is very famous for Ayurvedic treatments like Panchakarma. Simultaneously, Kalari Chikitsa also established and it occupied its own area where you can deal with more injuries. When you are treating a particular disease, you will generally approach to an Ayurvedic practitioner. But whenever you get an injury, then there is a more possibility in Kerala is to get an access to a Kalari practitioner. It includes management of injuries and maintenance of physical health. Principles of Marma Chikitsa. What's the principle behind it? What we are following it? Sharira Shastra, when we go for Shariram explained in Kalari Chikitsa, when you will get the references of Symptomatology, because I am an Ayurvedic doctor. When we compare the things, we can feel that it's like more getting closer to the Sharira explained by Symptomatology. But when we are coming to the Chikitsa, many yogas we can see it's similar to Ashtanga Hridaya, because Ashtanga Hridaya is more closely related to the Kerala culture. So the drugs what I mentioned in the yogas, we can find the similarity. And when we go for the Pathya, even I think Pratap Sir told that without medicines, when it is going for a acute injury, we will treat many of the cases without medicines, only with the external applications. But when you go to the injuries like on the chest, Rektandupi, for example, Stanamula, Stanarohida, these injuries, then you are supposed to give some internal medicines also, like Laksha Churna along with Siddha and Godukta. These kind of treatments are, these kind of internal medicines are also practiced for Marma Bigada. Branarogi Pathya, it's taken, it can be taken like a Branarogi, because it's like an injury. If it can be considered as a Madhyama Roga Marga, there will be an injury for some particular tissues inside which are not visible for us. So you are supposed to go for Branarogi Pathya, like whatever it is mentioned in Venroga. There will be a transformation of Marma Bigada, like it's come say Agandu. There will be an injury, and if you are not handling it in a proper way, it can be ending in Nijaroga. That's why, sorry, that's why it is mentioned in Vadavyadi Nidana. Marma Bigada is also a cause for many of the diseases. Generally, when we go for, we can go for even like Pakshagada, not Pakshagada exactly, like Yegangavada, when you go for Gridrasi, when you go for Kadigraham, when you go for Manyastamba, there will be a, you can identify some history regarding Marma Bigada. Main areas: counter techniques for injuries, management of chronic injuries. We can classify the Marma Chikitsa into two, like for a acute injury as well as for a chronic injury. Manipulation of Marma. Manipulation of Marma points, I already mentioned few points, and different manuals of are mentioned for correcting the Marma points, as well as when we go for the next line of treatment, it will come for the dislocations and strains. That is more widely practiced in Kerala. Why? Because when we go for the strain and dislocation and the management, what is happening in modern system, we know they will be going for an immobilization for a long time. But in Kalari Chikitsa, there will be a rebandaging technique similar what is mentioning Susudha, but the time period is a little bit debatable, because 3 to 4 days we will rebandage the dislocations and ensure the movement. So maybe the patient will be regaining the movement and along with the strength of the dislocated arm or a knee by 1 month. Maximum 1 month he will may be immobilized, but the restriction of activity will be gradually reduced by the rebandaging happening on the weekly once. We will make them to ensure the confidence. Principles of Marma Chikitsa and we go for the management of dislocation. Dislocation, reduction and bandage is happening. Repeated after 3 days to ensure the improvement. That's what I'm saying. Ensure the mobility of joints. Treatment follow-up to improve the joint to avoid repeated dislocation. Because even you are treating a dislocation, it is reduced and bandaged and it's okay. But there is a concept that you should go to a advanced treatment like totally method along with some kashaya to ensure that the patient should not face another dislocation in the future. And management of fracture. Dhara. Sometimes we will go for Dhara, especially for the children. You are supposed to do a Dhara in the beginning, and you have to correct the bone, and you have to go for an adhesive bandaging. Reverse bandaging to avoid mold union, you have to check. Sometimes because now we are not treating the compound fractures. Complex fractures are not taken, only simple fractures are handling in Kalari. Olden days, there is a chance of malunion, and there is some particular yogas mentioned in Kalari to break it and rebandage it. Some external applications are made to bandage in a malunion area, and you can break it. The bone get fragile in 2 to 3 days, and you have to break it and rebandage it. There are also techniques. There are so many techniques which are not using now, but there are some particular yogas still it is available. Internal and external medicines to promote healing. That is a must. Not only like an external medicine, you are supposed to give some internal medicines also. Now we go for the chronic injuries. Identification of affected Marma point from the manifested symptoms. For example, when a patient is coming to you with a history of wasting of muscle or loss of body weight, you had to identify the history of any Marma Bigada in recent years. Then you are supposed to go for a generalized treatment. Then we go for generalized Kidi, like a Potli Sweda method with drugs mentioned in Kalari Chikitsa, as well as Urichil. Urichil is a particular kind of treatment mentioned in Ayurveda. Even you can go for a Urichil by using your hand as well as feet. here the management of chronic injury is having more significance in Kalari Marma Chikitsa. There is a transformation of Marma Bigada is clearly mentioned in our classics also. Sadhya Pranahara Marma, when you get injury to the nearby areas of Sadhya Pranahara Marma, means that's not severely affected the Sadhya Pranahara Marma can be transferred into a Kalandra Pranahara Marma. Same way, an injury which is nearby to the Kalandra Pranahara Marma can be transferred to Vaigalagara Marma. This transformation is happening. So its identification of the time, place of injury is highly important in identifying the disease which is happened by a Marma Vigada. Approach of Kalari Chikitsa and general health. Because in Kalari, Urchil was introduced, the foot massage using, it's like it can be compared with hard massage like Udvardhana, but we are using with Sneha, with oil, and the massage is done with the foot. It is to increase the flexibility, to gain the body flexibility, and you have to do it to avoid complications also. Even you are flexible, you are supposed to go for Urchil yearly once to maintain the flexibility and to avoid complications when you are practicing Kalari. That's for the Kalari students. And when Urchil is mentioned, it's a particular technique claims to expertise the Kalari master to administer massage with his legs on the body of the patient. That's expertise he gained from the practice of Kalari Paitu. Strength and stamina attained by the martial art training provide a complete flow. Why? Because that's a peculiar concept in Kalari system. You are supposed to administer the treatment to the patient only when you are practicing regularly, because it's a must, because keeping your physical fitness. Like, I'm a doctor who is not like a doctor, is a Kalari master who is administering massage your treatment to your patient. You are supposed to go for the exercise and you keep your ability and agility, stamina, everything. Then only you can complete the 45 minutes foot massage administering, which is highly difficult. So when you are efficient, then only you can go for the treatment, and then only it will give a result. Indications and contraindications. I think last session one question was that there was any contraindications. Of course is there, because when Urchil is taken say method of treatment, then you are not supposed to go for Vada Pitta Rogi. What you can take the contraindications of Vyayama. When it is a lean person, when it is a Vruddha, then even it is a generalized disease you identified after a Marma Bigada, sometimes we are not supposed to go for an external manipulation technique or external massaging techniques if he is weak. So also the Jwara is a contradictory thing when we coming for the massage techniques used in Kalari Chikitsa, because we identify in Kalari, Jwara can be produced by an Marma Bigada. So you have to identify that particular Jwara which has a history of Marma Bigada. On particular that Jwara, you can go for the massage. But generally, when we think in an Ayurvedic manner, a Jurida patient are not supposed to go for a massage. This is the different what I get when I am going through the treatment methodology. These are the pictures of Kalari Chikitsa, particularly the Urchil. This Urchil is advised for a general Kalari student, a common Kalari student, to gain the flexibility. These are the methods of treatment what we administer: Lebam, Dara, and Vadipa. Lebam, it's when it is coming for the injuries on the central part of the body. Many of the times, along with the manipulation techniques, you are supposed to go for some Lebam. Lebam means external application of some pastes. For example, Marma Guliga. And Vadipa is when we come to more swelling. You identify swelling in the joints, then you are supposed to go for Vadipa. It's like a plastering technique. Along with the egg white, we use some churnas and grind like a paste and use to get the usual bandaging techniques, but it will be without administering any oil. You are supposed to keep it for at least 1 week. Then the swelling will be reduced. Then you have to treat for the mobilization when it is coming to the joints. Kiri is the another method of treating the chronic cases, like when you get an injury of the ligament injuries, for example, you are not treated in a proper way, coming to you with the swelling and pain, you go for the kiddy. There are particular kiddies like Elakidi and Manyakidi and Mamsakidi. Even Mamsakidi depends on the condition, you can go for the kiddy methods, and there are particular regional kiddy. Usually when we think about the kiddy or Potali Sweda, in Ayurveda we think about the whole body procedure. But in Kalari, we are using it for the Anga Pratyanga Vibhaga, like on a particular area. When you get an injury, like a chronic case, you are going for the kiddy only on a particular area, along with some Kashaya supplementation. Medicines used, I think few points are explained by Pratap sir. Sneha Kalpana, when you go for Thaila preparations, there will be a Thailam, Yamagam and Trivardam. There will be a combination of 2 oils or 3 oils, or like ghee, oil and milk. There will be a combination we use. And Leba Kalpana, these are the basic things. Chenninayagam is the extract of Kumari Spirasa, and Kuwa, it's like arrowroot, and egg white, these are the combination. Egg white is always used along with the Leva Kalpana to gain a binding property. Kashaya Kalpana will be like, it's a modified technique of Mamsarasa preparation. Aja Kukra Mamsa are used because we know, like it's a concept in Ayurveda like Mamsa Mamsena. The similar way, when you get the injuries of the joints or spinal cord, you are supposed to go for some Kashayams along with Mamsa Prayoga. That's a concept followed in Kalari Chikitsa. Now we go for the conclusion. It's an explanation of Shariram and Marma by Ajeta Sushruta is followed in Kalari Chikitsa. It's already mentioned by me because it's an advantage of Ayurveda that we have a very established system of anatomy which is following in our treatment principles. So it is widely used in Kalari Chikitsa also. While moving to the medicinal preparations, we get, it's more related to Ashtahridaya preparations, because we know the practice of many medicines in North India is different, and in South India it's more easy. Now, due to the pharmacy establishments, we get most of the medicines in any part of our country. But before it was not like that. Regional wise, there are classical preparations which is more available with the drug availability in the particular area. Management of injuries in Marma points are exclusively dealt in Kalari Chikitsa than Ayurvedic practice. We know when we are dealing with a wound like a vrana, it is a little bit more risk is there. Similar way, when you are treating a person with a sudden Marma Bigada, the complication will be more and the your responsibility will be more. So the practice and knowledge of Marma is highly important when we use it in acute injuries. Expertise in handling injuries made the stream again uniqueness and importance in Kerala through centuries, because we know it's not happened all of a sudden. Expertise in handling injuries even from the warfare was transformed gradually, and the decline happened, and so many knowledge we even now the practitioners of Kalari to have not that efficiency which was followed in 18th century, but still it is possible. Why? Because they are following a tradition of practicing Kalari along with the medicinal system. Good knowledge in anatomy through academics can be used properly in Marma Chikitsa to get good result in musculoskeletal injuries and neuromuscular diseases. I always suggest when we are going for the discussions, we can use Kalari, because in I heard about I think many of you heard about AVP, Ayurveda Pharmacy, which was having the capital center in Tamil Nadu. They introduced a particular way of teaching, like Bharati Shastras are taught along with the curriculum in the, for the students. They taught Kalari also. When we learn Kalari as a basic for at least getting the body flexibility, where along with our Ayurveda treatments, Ayurveda curriculum, it will be more genuine to convey the knowledge of or take over the knowledge of Marma Chikitsa into our curriculum. Without having that influence or that encouragement in our mind to accept the that Vyayama system in our curriculum. Only the taking the treatment part, it will not be that much beneficial, and it is ethically incorrect, what I should say, because I'm coming from a traditional part of Kalari family. I'm supposed to say that, so I use this platform to say that also. At present, it is necessary to establish Marma Chikitsa in the curriculum of Ayurveda to make it more available to the society and to prevent misuse. I already told that I am representing Kalari system also. There is an association like Kalari Pite Association, which was handling the Kalari as a sports field. They are thinking in another way that it should not come to Ayurveda, because Ayurvedic people are not relevant to do these practices. Why? Because it's still established in a different system. But what happening means, without the knowledge of anatomy and physiology, using Marma in each and every diseases, or it's giving a false statement that you can treat everything with Marma is also a problem. So integrating things in a medicinal field is more comfortable and it's more good for the society. So we should think about it, and we should make it happen as a part of Ayurveda. And finally, the facts, because always I say, when we go for the Marma treatments, you are supposed to get the knowledge directly from the guru who is teaching it, because it's a hands-on training is highly important and highly recommendable also. But this is considered as a theoretical section to have an introduction and about the concept of Kalari Chikitsa, which I can compare with Ayurveda and discuss in a platform like colleagues like you. And I expect questions from you that can be made more clarified. Okay, Alok sir.
Okay, thank you, sir.
Okay.
Thank you very much for in-depth clarification about all the terminology related to Kalari specifically, and also giving some future prospects how to utilize this particular. One point I'd like very much that what you said, that it should be included in curriculum of our Ayurveda itself, so that more research, more things can be done in more elaborative manner.
Yeah.
Ma'am,
Yes.
yes.
Can I, Dr. Gaurav?
Yes, ma'am.
Yes, sir.
Yes, ma'am.
Yes, ma'am.
Thank you so much, Dr. Gowthaman. I have a question.
Yeah.
Like we have Panchakarma for detoxification in Ayurveda.
Yeah.
Anything specific mentioned in Kalari specifically to maintain the marmas what we have, so that the resilience, the flexibility is maintained for a longer time?
Okay. Actually, madam, I already mentioned that Urishil, that's like foot massage. That is considered like a Panchakarma treatment in Kalari. Why? Because even if you are a practitioner of Kalari, if you are regularly practicing any kind of exercise or anything, to gain the flexibility and maintain the flexibility, you are supposed to go for a 7 days of treatment, like a 7 days of course of treatment ending by a Virejana is recommendable yearly once. I think ma'am heard about the Karkadaga Chikitsa, like rainy season in monsoon treatment is highly propagated in Kerala. In Kerala, it's more people are coming to Kalari for the monsoon, at the time of monsoon, to having such a treatment to maintain their body like a youthfulness and the body flexibility from different, like even actors and everybody is coming for the particular kind of treatment to get this effect. And always it's led by a virejana, like a cleaning of the body.
Thank you.
Okay, thank you.
Hello, sir. One more point. Can this particular practice can be used for self-improvement or self-healing? Means it can be practiced by oneself itself if the points are permissible to do it.
Yeah, it's not contraindicated. Why? Because I told like Abhyanga as a daily practice is happening in Kalari. Because before going for the practice, we used to put oil by yourself, means ourselves. Then at the time of injuries, there is a possibility of small injuries in practicing Kalaripayattu as a martial art is happening. And if you are efficient, gradually gaining the knowledge, you can correct some small injuries by yourself. But when it is going to the injury which is severe, you are supposed to get help from other people. But self-management is possible. Why? Because for the injuries in the acute manner, there is no use of, we are not recommending any medicines internally. It's not highly influenced. Only the external manipulations are implied. So you can go for the self corrections also.
Okay, thank you, sir. Sir, you have said to show us some videos.
Yeah, I
If
will.
it's possible. Yes.
Yeah. I'll just go for a video which is bandaging of elbow. Okay.
Okay, sir. Okay. It's not playing here. It's not visible.
It's not visible.
Yeah.
Is it visible now?
No, sir.
I'll check it again. Can you see the slide now? Is it?
The page is visible, sir. The page is visible where 4 videos can be seen, but when you play it, it doesn't play on the screen.
Is it visible now? No.
No, sir. I think again you have to disconnect and connect
I will.
yourself.
I will try.
Specific. Sir, I think it's better if you share the entire screen after playing the video, then it might show. You're mute also, sir, right now. You're mute. Only the sound is coming, sir.
Okay. Can you see now?
No, sir.
No.
Okay, I think there is some problem.
Yeah.
We can plan it for next session.
Yeah.
Okay, sir.
Any other doubts?
If anybody is having any doubt, so I think no, there is no queries further. If any queries will be collected by us, we will forward to you.
Yeah.
Okay, sir. So thank you very much, sir, for your elaborate lecture. and I will now pass the things to the director madam to give a small feedback on today's webinar. Ma'am,
Uh,
please.
I think it was wonderful listening to both of the eminent speakers. I should appreciate the honesty of Dr. Pratap Shankar ji, where he says he's sharing the projects apart from being a very eminent doctor in this field of Marma therapy. Otherwise, I don't think he would have been indulged and engaged in CCRS. And I think every practitioner, every BMS graduate should be practicing this, learning this, and we can revive this again because we all are trained in Ashtanga Ayurveda. Instead of aping the modern conventional systems today, we have divided ourselves in different, what I should say, streams. And one becomes a gynecologist, one becomes an anatomist. So instead of that, the important thing is treatment, and therefore everybody should be well versed. And thank you for enlightening this to us, sir, empowering us today. Again, we have revised, and I think with your lecture today, many of us would like to go to Kerala to be under Guru Shishya Parampara, to learn Kalari Payattu, and to learn the Marma therapies from you. And I know that you will be definitely welcoming each one of us here, whoever wants to and wishes to. So thank you for maintaining this ancient Indian science, sir. You are a guru here. Thank you very much. And thank you to every participant. I see many of my classmates from Hyderabad also, and many of my friends and students here. Thank you so much, sir, for giving this lecture today. I hope we will have more of this. And I wish pan country, we should have this Marma Chikitsa OPD in each and every hospital. Thank you so much.
Thank you, ma'am, for your.
Thank you, ma'am.
Thank you.
So now I pass to the Dr. Alok Kumar sir for the vote of thanks for today's webinar. Dr. Alok sir. Dr. Alok.
Yes. So as a formality, just we need to say thanks to. First of all, I would like to extend my gratitude to our respected director, madam, Professor Neeta Maheshkar ji, ma'am, for their guidance, their support, because this was the program we have in our mind. Me and Dr. Doro decided to do something regarding this Panchakarma therapy. So in this, just one a single time I asked ma'am, just she said, yeah, we can go through. So thank you, ma'am, for supporting us and guiding us. And next, I would like to say thanks to our both guest speakers, Dr. Pratap sir and Dr. Gowthaman sir, who have spared the time from their busy schedule and with a very short period of time. So thank you both, sir, and for enlightening us with this Marma therapy. This is only introduction part. So we are not able to grab all the things whatever he says, sir, but we try to learn, and as we are enthusiastic to know and learn this is new things, so we are just trying to learn more and more. Next, I would like to thank our principal in charge, Dr. Vijay Kumar, who is not on the station, but he has given support and the guidance. And I would like to thanks to the technical team. That's he is our JE, Mr. Prantik Sharma and Mr. Dhaneshwar, who has given their time, their hard work, the supports. That's why it could be possible. And it would be very unfair if you won't say thanks to our students, our organizing committee, our faculty members, and the other students and other faculty practitioners who has joined here, who has registered themselves with this webinar. And I hope they all have gained something, and they must just getting some inspiration to start this holy practice. And because what I fascinated with this Marma therapy, that is totally drugless therapy. So minimal infrastructure is required. If we once learn and we start practicing, that will be very helpful for both doctors and both the patients too, because no infrastructure is required. Only the hands will be enough. And lastly, I want to thanks to all the viewers who are watching us on the YouTube. Just one more request, we will forward one feedback form. So just kindly fill up that feedback form and submit it, so we can know that where we are lacking something, or if any need of any improvement, just give your suggestions. That will be very viable for us, because this is a long journey, and this is the first baby step we have taken, and we have planned to go a long way. So thank you everyone. Thank you very much, Dr. Gaurav.
Thank you, Dr. Alok. So, with permission of our director, madam, I conclude the session, hoping that we will meet again soon with much more deliberation, but now on some specific topic, specific disease, with more of the practical things, less of the theoretical, more on the practical. So, thank you, everyone, all the viewers, all the persons. Kindly fill the feedback form so that our experts can also know how to do more better, and whatever questions we are getting right now also we will be answered in our next webinar day. Thank you very much each and all. Jai Dhanvantari.
Jai Hind.
Jai Hind.